PRS-343 is a bispecific construct that's technically not an antibody, but basically it's a construct against HER2 and 4-1BB. So HER2, of course, is well known and has been a therapeutic target for more than 20 years. 4-1BB is less well known. It's an immune agonist molecule that's found on activated T cells. So essentially what this molecule does is that it brings together HER2-positive cancer cells with activated T cells, and therefore allows facilitates the recognition of the cancer cells by the T cells. So 4-1BB antibodies actually have been looked at over the last 5 years, and they clearly are active and are able to activate the immune system. But the major problem is that they actually have had too many side effects. So liver inflammation as a result of immune activation was a major problem with the naked 4-1BB antibodies. So the idea behind PRS-343 is that rather than activating the immune system, throughout the body, it's really only activating the immune system around the tumor cells as well. So it was looked at in phase 1 studies, both on its own, but also in combination with Atezolizumab, which is a anti-PD-L1 antibody, with the idea then that we're potentially activating the immune system through two kind of related but separate mechanisms. So, overall, I think certainly the most important take-home point is that the combination is PRS-343 on its own, as well as the combination, are pretty safe. The major toxicity that was seen with PRS-343 is an infusion-related reaction, but it's grade 1 to 2 in the majority of patients when it happens. So that's why it was about 20%, both as monotherapy and in combination with the Atezolizumab. Beyond that, there were mild constitutional symptoms and some mild gastrointestinal symptoms. In terms of activity, I would still consider it largely to be anecdotal at this point, but certainly we're seeing responses in patients who've had progression on other HER2 therapies. Most patients are heavily pretreated, and when these responses occur, they are durable. So I think it's proof of concept that 4-1BB directed therapies can be effective, and I think based on these data, the next series of studies will begin to look at specific diseases in a kind of phase 2 way to try to get a stronger signal of activity. So specifically, the follow-up study that's planned will be in gastric cancer, and will be in HER2 gastric cancer in the second-line setting, for which currently the standard of care is ramucirumab Paclitaxel. So PRS-343 will be added to that combination to try to get a more specific assessment of its activity in that context.